Hello, my name is Dr. John Hui. I'm a consultant urologist in Gleneagles, Penang. What I'm going to share with you today is something about prostate cancer. Prostate cancer is the fourth most commonest cancer in Malaysia, and it is the ninth most common cancer among all the cancers. Prostate cancer is generally a slow-growing cancer, and most people die with the cancer and not die because of it. However, it is a cancer more likely to affect more elder people above 60 years old, but we do see patients who are younger, and those people who have diagnosed at a younger age have usually more aggressive disease. There are a few risk factors for prostate cancer. Age being one of them. Family history of prostate cancer is the other. Early prostate cancers are usually asymptomatic, which means they do not have any symptoms. Therefore, they are known as a silent killer, or rather a silent cancer. Only a few people may present with symptoms, and the symptoms are usually difficulty in passing urine, hesitancy, going to toilet more often, sometimes painful urination, blood in the urine, and of course, in more severe cases, they may have symptoms of the disease which has progressed to other parts of the body, like bone pain or feeling unwell. How do we diagnose prostate cancer? Prostate cancer, as I said, it's a very silent killer. So generally, it is a combination of patients who come to our clinic with urinary symptoms, and in the clinic, what we do is assess them through taking a good history, and what we need to do is actually to examine the prostate. How we examine the prostate is by putting an index finger into the back passage of a patient to have a quick feel of the prostate to see whether it is hard or is there any lumps or not. Other tests which we will perform in the clinic is blood tests, and this is called the prostate specific antigen. The blood test of prostate specific antigen, which is elevated, does not mean that you have prostate cancer. The true diagnosis of a prostate, once we have ruled out other causes of a raised PSA, we will have to perform a biopsy of the prostate to confirm the diagnosis. This prostate biopsy is usually done as a daycare procedure, whereby we would take a few samples of the prostate and send it to the lab to be tested. Once we have confirmed the diagnosis of prostate cancer, we would then further need to do radiological evaluation, staging, such as CT scans, MRI of the prostate, or bone scans. The treatment of prostate cancer is something where the doctor and the patient has to discuss. But in short, the treatment can be divided into three main categories depending on the stage of the patient. In early prostate cancer, whereby the cancer is still limited within the prostate capsule, the mainstay of treatment is of course surgery to remove the prostate. This is known as radical prostatectomy. Radical prostatectomy can be done either robotically, laparoscopically, or the conventional open method. So prostate cancer, usually we can divide them into localized prostate cancer, which means the cancer is still within the prostate. The second one is called locally advanced prostate cancer, whereby the cancer has spread out of the prostate. And the third one is metastatic cancer of prostate, whereby the prostate of the cancer has gone out of the prostate capsule into the surrounding tissue, usually the bones. For locally advanced prostate cancer, the treatment usually will be a multidisciplinary approach, whereby the urologist and the oncologist will discuss with the patient for the best treatment for him. And that usually involves a combination of radiotherapy and hormonal therapy. For metastatic prostate cancer, which is the cancer that has spread out of the prostate to other organs, the treatment will be also a multidisciplinary approach between the urologist, the oncologist, and the patient. The usual treatment will be either hormonal therapy, chemotherapy, or targeted therapy. Prostate cancer is a disease that, if detected early, can be treated. We encourage everyone to come for screening after the age of 50 years old. I hope this sharing of mine with regards to prostate cancer can be beneficial to everyone.